Thank you for joining us for this discussion today on the impact of the Affordable Care Act on healthcare access, cost, and quality. I'm Maria Wharton, and I would like to thank the other members of our group, Chidi, Esiaba, Joseph Myer, and Agnes, Siemsen, for their contribution to this presentation today. I'm going to start out looking at who was newly covered under the Affordable Care Act and how we achieved this. So we see that 20 million people have gained healthcare coverage since the enactment of the Affordable Care Act. And those people have come to us in many different ways. We see that we have a lot of formerly uninsured young adults who now have coverage as they are allowed to remain on their parents' policies until they reach the age of 26. We see that the uninsured rate among minorities has increased remarkably. So much so that overall the uninsured rate for all Americans is now down to 8.6%, where it had been 15.7% of Americans were uninsured before the Affordable Care Act was signed into law. So how did we get all these people covered? One of the important aspects of the Affordable Care Act is the individual mandate that requires everyone to have insurance, either through their job or by purchasing insurance on the individual healthcare marketplaces or expanded coverage of Medicaid. So we know that for the individual mandate, for those who are purchasing care on the health exchange, for those people who choose not to purchase health insurance and go without, there is a penalty applied to them, and that happens when you file your federal taxes, and you will pay a penalty that is at the maximum $2,085, which is the cost for a bronze plan sold on the marketplace for a family. So it's 2.5% of your household income or that $2,085, whichever is a lower number. So having everyone covered definitely provides funding to those insurers to cover the healthcare cost of all those newly insured consumers. The other big way is the expansion of Medicaid, which gives coverage to everybody who qualifies, and that is based on a percentage of income related to the federal poverty level. And prior to the Affordable Care Act, that threshold was set differently in every state. Now it's uniform throughout the country. Initially set at 134% of the federal poverty level, but some things have changed since then. So of those 20 million who gained coverage, well over 900,000 of those were individuals that received care under the expansion of Medicaid in the various states. So under the Affordable Care Act, what are those healthcare exchanges and how are they different from state to state? So under the Affordable Care Act, there are 5 different ways that those exchanges can be set up in different states. So we'll see that those selections can be made either through 25 of our states have federally facilitated options for their health exchanges. 12 states have decided to have a state-run option, and then the other states have either a blend of state and federal support, state and federal partnership, or individually federally run in different states. But all of the policies, regardless of what kind of marketplace you have in your state, are required to cover what has been determined under the Affordable Care Act as essential health benefits. And those are mandated to be covered and provided regardless of the individual, the plan, or the state that you live in. And those things include coverage of emergency room care, physical therapy, and various other types of outpatient therapy and supplies, prescription drugs, laboratory testing, mental health and substance abuse services, pediatric services, maternity and newborn care, preventative and wellness medicine services, outpatient and ambulatory services, and hospital care. So all of those different types of services must be provided in every plan that is sold on the health exchange. And in order for employer plans to be considered meeting this mandate, they must cover these services as well. Here we have a map that shows you how different parts of the country have chosen to implement their exchanges. So you'll see there's some geographic similarities in the Midwest and the southern part of the country with federally facilitated marketplace exchanges. Only a couple in that really light purple area that are federally run, but individual marketplaces in the states. A few spots sort of in the middle of the country that are state-federal partnership, and then a number of either state-run exchanges that are federally supported or solely state-run exchanges. So lots of different ways you can look at that map and see how your state has chosen to run their exchange, and maybe interestingly enough, how states contiguous to you have, so that you would see how people might see different opportunities in neighboring states. So what has been the impact of the Affordable Care Act on Medicaid? So the Affordable Care Act expanded Medicaid so that more people can qualify under the provisions. So in 2014, Medicaid eligibility was expanded again from the early implementation of the Affordable Care Act, so that the threshold is now for people earning up to less than 138% of the federal poverty level is going to cover more of the poor to make sure that they have access to care. And also the expansion of the Affordable Care Act decreased the premiums for that medical assistance or Medicaid to again cover more people and allow Americans the ability to afford that health care coverage. What it does take into account is that for those states where who chose not to expand Medicaid in their state, they're seeing that taxpayers are then having to foot to the bill for the hospitals who are continuing to see a large amount of unpaid healthcare bills and a lot of charity care, and those costs are then passed on to the taxpayers in that state. So there's continued cost there for the states that chose not to expand Medicaid. So a lot of focus lately on how health insurance premiums have been affected by the implementation of the Affordable Care Act. And some very interesting things have gone into this. So premiums are no longer based on a patient's health history, their medical history, or their gender. So in the past, women were charged more than men. A lot of that was based on projected healthcare needs related to maternity care, birth control costs that just didn't factor into healthcare premiums for males. Those can no longer be taken into consideration. Your past health history of chronic illness or cancer, things like that can no longer impact your premium, although insurers know that they will have increased costs to cover based on those pre-existing conditions, and your overall health. So when they're setting premiums, health insurers can now only consider 5 factors. That is age. So younger people typically pay less in premiums than older people, but the amount that older people can be charged in premiums is now limited to 3 times that the premium of a younger person. So they can't really increase those premiums for older people who, by history and actuarially evidence, use proportionately a much larger portion of healthcare services. The second factor is location. So where you live can impact cost of living, cost of providing services, competition in that area, state and local rules all play into that. So premiums are going to be different in higher cost healthcare areas than they are in lower cost healthcare areas. Tobacco use. Users can be charged up to 50% more for health insurance than non-tobacco users. 50% is the maximum. States are allowed to set that premium for themselves, but it cannot exceed the federally mandated 50% limit for that. Individual and family enrollment obviously is allowed to be different because you're covering more than one person. And then the plan category. So each healthcare plan is going to offer bronze, silver, gold, platinum, and catastrophic options. And those plans that cover more and have maybe a lower deductible and a higher um, percentage of the cost that's paid by the insurer are going to have a higher premium. But no longer are you able to consider some of the things that insurers have considered in the past. Um, the key things being that health history to determine those premiums and help cover their costs. So there are several variables that are playing out in the political debate over the impact of the Affordable Care Act and what we might do next, and how the Affordable Care Act has impacted both cost, access to health care, and the quality of care. So when we're looking at the impact of the Affordable Care Act on cost, we look both at the cost of health care and the cost to the consumers. So the Affordable Care Act was supposed to address the rising cost of healthcare over the previous decade. It was supposed to look at fraud and abuse and to help get rid of inefficiencies in the healthcare system by supporting the introduction and ongoing use of electronic healthcare records that would, by its very nature, decrease duplicative care and increase efficiency, as well as structuring the healthcare system to move from a fee-for-service model that paid for volume of services provided to a value-based purchasing model which paid more for outcomes rather than care provided. So we see that the increase in healthcare services has flattened. So the rate of healthcare spending has gone up much more slowly than it had prior to the Affordable Care Act being implemented. But many will argue that the cost of healthcare continues to rise due to the increased Medicaid expansion and the costs associated with that, the federal subsidies that are required to keep the healthcare exchanges afloat, and the pharmaceutical discounts that are required, the incentives they're paying to primary care providers to increase provider access in underserved areas, and the cost just to maintain those healthcare exchanges. So there's a lot of cost associated with the Healthcare Affordable Care Act that we need to be mindful of. And then we want to look at the impact of the Affordable Care Act on access to health care. So certainly access to health care has increased as more people have insurance and they have ability to pay smaller premiums, if any, and have access and ability to go to providers for some of that preventative care or earlier care when they have a healthcare concern. But access is not just about having coverage, it's also about having providers to receive that care from. So again, looking at those rural and underserved areas, while I may have insurance that now lets me see the doctor, if I have to wait a long time because there's not enough providers, I may end up in the emergency room anyway when my blood sugar is out of control or my COPD is flaring because I don't have a provider that I can access easily enough. So there's definitely concerns with having enough providers, as well as did I have to change providers when I bought this insurance? So maybe I had somebody that I was able to see in a prior health plan, and then I lost my job and I had to buy a plan on the insurance exchange, and I had to change providers, and maybe I have decreased access because I have a new provider, or the provider doesn't provide that same quality of care, really not because the provider is different, but because I have less trust and less faith in that provider. So the impact of the Affordable Care Act on quality, again, has to do with the potential for shortages of providers, as well as the ability of smaller providers to be able to collect the data that's required for reporting for value-based purchasing and all the infrastructure associated with collecting, compiling, and submitting that data to the government as required. They just don't have the same scope of support for that. So they are limited in their ability to compete in the terms of the quality metric reporting with larger healthcare systems that have that infrastructure in place already, so that when the reimbursement is tied to that quality metric, those providers that don't have the infrastructure are set up then to get a decreased reimbursement, which then further decreases their ability to compete on that same playing field as the larger healthcare systems. So there's definitely some quality concerns that we need to be mindful of and challenges of under the Affordable Care Act. So looking at those implementation challenges that are facing our state and national policymakers, certainly a lot of that being discussed in the news. The implementation of the Affordable Care Act was about expanding access to health care to everyone, about reducing the costs associated with providing health care by focusing on quality over volume and weeding out fraud. Making sure that we're improving the quality of health and the outcomes and stabilizing that healthcare market. So all of this really looks back to the quality of care that's provided, and so it's important to understand just what is healthcare quality as we're talking about the Affordable Care Act and healthcare in general. So looking back at the 2015 Institute of Medicine report, in which healthcare quality was defined by 6 key attributes. So safety, that the care provided is safe for the patient and the provider, that the care provided is patient-centered care, that care is timely, effective, efficient, and equitably provided to all. So in order for us to continue to extend quality care to the millions of Americans who now are insured, policymakers need to really look at the healthcare workforce and what they can do to support an increase in primary care providers, especially in the rural and underserved areas, and look at what has to be done to keep consumers continually enrolled in healthcare coverage rather than having them disenroll when they're well and then hopping back into a healthcare coverage when they're getting sick. Which leaves the insurers in the place of not having had those premiums accumulating to cover the next health crisis for that person. So when that happens, then insurers are left with no choice but to increase premiums for everyone to compensate for those losses. And then the work that needs to be done to continue to stabilize those healthcare exchange and healthcare marketplaces to ensure that everyone has access to affordable health plans. So lots of challenges there on both the state and the national level in implementing these directives from the Affordable Care Act. So what are some of the strengths of the Affordable Care Act? We know that more people are covered. We have 20 million more people who have health insurance through the exchanges and the Medicaid expansion. 31 states and the District of Columbia have expanded Medicaid. And we know that more health care is being provided now that preventative care is covered, maternity care, people have better access to mental health when it's available, and some prescription drug coverage. So all of those are good things for the health of our nation. It's important to know that coverage can no longer be denied due to pre-existing conditions. So all those pre-existing conditions are covered. We just have to find a way to make that care sustainable for the insurance companies. So that's important. But we also know that insurers and healthcare providers are making more money. So many of the top insurers are seeing their profits rise. A New York Times article by Johnston in 2015 is quoted as saying that the insurers were the most direct beneficiaries of the Affordable Care Act, with the big players Aetna, Anthem, Cigna, Humana, and United Health consistently outperforming the Standard & Poor's 500 over the prior 5 years. And then a year later, the Commonwealth Fund brief on the topic said that overall that insurers were seeing a profit of up to 7.6%, and for those top insurers, so they were doing well, and healthcare providers were also making more money. They noted that providers with superior patient experience ratings had seen an increase of up to 50% in their net margins, and a decrease in charity care as well. For an example, the Oregon Health Authority reported that their profitability rose by 35% in 2016 over the prior year, and their charity care decreased by 39.4%, or $342 million in 2015. So definitely that increased coverage is helping those healthcare providers. All of this is happening under the effort to meet that triple aim of the Affordable Care Act of providing better care, better population health for our country at a lower cost. With that being said, the Affordable Care Act has its challenges as well. There is a lot of concern at the increased out-of-pocket cost for consumers. So some of that is consumer choice of a high deductible plan that gives them lower premiums, but then they have higher costs when they do need to use that health care. And then the overall need for higher premiums because insurers are now required to meet that minimum level of coverage, whereas in the past they might have been able to provide programs that just provided hospitalization coverage. Catastrophic, if I was in a car accident, I would have coverage, but otherwise I'm pretty healthy, so I don't really use health care. Or I can use health care at a community clinic where I can pay out of pocket at a cost that's affordable to me. Another reason for increased out-of-pocket costs is that insurers really had a learning curve when they were setting up their premiums because they were required to recover pre-existing conditions that they hadn't covered in the past. They no longer had the ability to place lifetime caps on what they would cover for somebody with a chronic or catastrophic illness. So they had to figure out how to price those premiums to make sure they had enough money to cover those costs. There were some new insurers to the marketplace that came in trying to take advantage of the increase in customers for health insurance who may have found that their business models were unsustainable and lost money and are no longer in the marketplace. Another challenge to the Affordable Care Act is that it still at this point requires government subsidies to remain sustainable. So the government has put into place 3 separate mechanisms that are designed to stabilize that insurance marketplace. They include a product called reinsurance, which reimburses the insurers for some of the costs associated with caring for patients that have really high medical costs. The second measure is called risk adjustment, which moves money from insurers who have provided coverage for a group of healthier than average patients, so have some profit or excess, and moving some of that money over to insurers who provided coverage for a group of sicker than average patients and may not have had enough money in their pool to cover that cost. And thirdly, a product called risk corridors, where insurers that overestimated the cost to pay into that fund then cover some of the costs for insurers who underestimated costs. So those things are all things that the government does to help keep that marketplace sustainable. We also see that we have increased costs to healthcare providers for the quality reporting that's required for value-based purchasing. So there's a lot of record keeping, a lot of data analysis and submission costs associated with participating in that value-based purchasing quality metrics reporting, and especially those smaller healthcare providers who don't have the infrastructure in place and the resources to do all of that are definitely at a disadvantage, as we said earlier, in competing with those larger healthcare systems who have much higher resources than they do. So that cost of that is again a cost of the healthcare system that has to be covered by the costs that we all provide. So overall, when we're looking at the Affordable Care Act, what kind of law is it? Is it a good law? Is it a bad law? Overall, we know that the Affordable Care Act provides a lot of good for a lot of people. Healthcare provided has increased. Charity care and dollars lost associated with that has decreased. And overall, the rate of increase in healthcare spending has slowed over the years that the Affordable Care Act has been in place. We see that well-established insurers and strong healthcare providers have seen increases in revenues and increases in their profits. The value-based purchasing aspect and quality measures designed to improve care and support consumer choice in the Affordable Care Act have yet to be realized. fully, so it's too early to grade the Affordable Care Act on those aspects. There are challenges to be sure, but at this point in time, the Affordable Care Act has strengths that support improvement in healthcare access and outcome for many Americans, and it should be supported. We've included for you a list of the resources that we used in putting this presentation together. We encourage you to check them out. There's a lot of good information out there that we wanted to share. So please take advantage of those. Hope you found this presentation helpful. We sure learned a lot putting it together. Thank you for sharing this time with us.